So I just want to introduce you to Amanda. Amanda is a board-certified music therapist who actually works with me at Sun Towers. Amanda's in our memory care, and so she sees this every day. And I'm just going to let Amanda take it from here. Can you hear me all right? She has a very soft voice. I'm going to just play a couple songs. I'd love it if you could sing with me. Let me call you sweetheart. I'm in love with you. Let me hear you whisper that you love me too. Keep that love light glowing in your eyes so blue. Let me call you sweetheart. I'm in love with you. He's got the whole world in his hands. He's got the whole world in his hands. He's got the whole wide world in his hands. He's got the whole world in his hands. He's got the itty bitty baby in his hands. He's got the itty bitty baby in his hands. He's got the itty bitty baby in his hands. He's got the whole world in his hands. Hey, good looking, what you got cooking? How about cooking something up with me? Hey, sweet baby, don't you think, baby, we could find us a brand new recipe? I got a hot rod Ford and $2 bill, and I know a spot right over the hill. There's soda pop and a dancing sprays. If you wanna have fun, come along with me. I said, hey, good looking, what you got cooking? How about cooking something up with me? All right. Thanks for singing. All right, so are we feeling a little bit more energized after that? Okay. All right. As Debbie said, my name is Amanda Zubillaga. I'm a board-certified music therapist. I went to Florida State University for music therapy, and I completed a 6-month clinical internship in a hospice in Jacksonville. But currently, I'm an activities assistant at Sun Towers in the memory care unit. And I just wanted to go a little bit more in depth with some of the topics that the video mentioned today. So first, what is music therapy? Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And that's a mouthful. But this definition is taken from the official American Music Therapy Association website. And the first topic I'm going to talk about is how music therapy reduces agitation. This fact is very beneficial for patients and at the facility as well, by the way of patients would be able to avoid taking antipsychotic drugs, which they won't be able to experience the side effects with that. And also with the facilities, they won't have to spend the money on these antipsychotic drugs. The specific music therapy technique that we use is called the musical ISO principle, and I'm just going to give you another long definition, but it's continuous patient-preferred music played live to elevate or reduce mood or level of stimulation in the listener. meeting them where they are initially and concluding at a desired level of stimulation as determined by the therapist. Now, what you just participated in without realizing it was an upward ISO principle. I met you at a little subdued level because we just had lunch and watched a video, and I slowly brought you up to a more energized state using different tempos with my guitar, different pitch, etc. But there's also a different kind called downward ISO principle, which is basically just meeting a patient at their more agitated, excitable level and bringing them slowly down with their preferred music. And I have a specific example. At Sun Towers, we had a resident that she was extremely anxious, one of the most highest levels of anxiety I've ever seen. Exit seeking, attention seeking. She was just a mess, basically. And none of the drugs were helping her. She was never sleeping, she was exhausted, but still agitated. So one day I brought my guitar to work, played her some gospel music because she was a Southern Baptist woman, and after some time, she went to sleep in her bed. And these ISO principles can vary in time, like the short one that we just did, or it can even go up to an hour. But nonetheless, that was one of the things that finally relaxed her, was music. All right. Next, the video mentioned that people with dementia draw inward, and that music makes them come alive. Oftentimes, people with dementia, when they hear music, they begin tapping, dancing, singing, reminiscing. This is because music brings back memories and overwhelming emotion due to its ability to connect multiple areas of the brain at once. Music is great, especially for reality orientation with people with dementia, because oftentimes they are in their own reality. They can maybe be speaking nonsensically, they can be confused as to time and space, even not making eye contact. But often when they're being encountered with music, they can sing an entire song in its entirety with all the correct words, they can make eye contact, they can even play instruments. And some of the specific music therapy techniques are sing-alongs, simple sing-alongs, or hand-over-hand instrument play, which is just a therapist guiding someone's hand playing an instrument. All right. Another topic that the video touched on was music used for entrainment. It could be used to even out the gait in Parkinson's patients, and the specific music therapy technique is called rhythmic auditory stimulation, or RAS, which is the use of patient-preferred live music with a strong and definite metronomic beat to entrain the individual. I have another short video for you that will illustrate just how effective RAS is. In this video, there's a gentleman who recently experienced a stroke, and he has taken 3 weeks of traditional physical therapy to get him to this point that you're about to see. So as you can see, his gait is very uneven, very choppy, and he has to use the cane.
Almost did. Okay.
And soon after this, they start rhythmic auditory stimulation, which again, you'll be able to hear the strong metronomic beat that the guitar provides, and you'll be able to see just how smooth his gait becomes. So they speed up the music, and they also take his cane away. And again, that's just with one music therapy session versus the 3 weeks of physical therapy. It varies with the individual, but because of its entrainment with the brain, it lasts for a really long time. All right, and there's some other uses of music therapy that the video didn't touch on. First, I'm going to talk about it can help achieve other therapeutic goals, for example, with the physical therapy that we just saw. Also, it can help with analyzing grasp in these patients. You can grasp musical mallets, you can do X shakers, you can track also the decline once the patient's dementia develops even more. But other goals that music therapy touches on are increased socialization, especially for older adults in long-term care facilities. They often feel isolated, maybe because their family lives in a different state or they don't come to visit very often. It helps them go through with reminiscence. They can identify and express emotions, range of motion activities, and it can provide distraction from pain as well as different things that are going on, like taking blood or anything like that. And I have one more video of how music therapy can help other populations, such as those that have traumatic brain injuries or TBI. And one of the most famous cases is Congresswoman Gabby Giffords, who lost her speech ability when she was shot in the head. But in this video, you'll see that she's going through a speech therapy, and she's unable to say the word light. But her speech therapist starts to sing "This Little Light of Mine," and she's able to say that word and much more.
On the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Are you frustrated? Can I tell you something? It is going to get better. Okay? It's frustrating right now, but it is going to get better. You've come a long way in 5 weeks. You've come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're going to do this. You ready? This little light of mine, I'm gonna let it shine.
Remember, at this point, she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine. Excellent. Well, good morning. Gabby, how do you do?
Maggie Morrow is Gabby's music therapist.
Why is it that someone who can't speak can sing?
Because music is accessed in many different areas of the brain that aren't designated for language. We're retrieving pitch, melody, rhythm through all these different areas, and those are working to get your language back.
Remember we told you that language is normally held in the left hemisphere of the brain. Music exists in both hemispheres. Incredibly, scientists are finding that music therapy has the potential to rebuild language on the uninjured right side.
Nothing activates the brain so extensively as music. And it's really only been in the last 5 years that brain imagery, which showed it had been possible to create a new language area in the right hemisphere. And that blew my mind. I would have said that's a fantasy.
Reminds me of being stuck in traffic on the freeway. You aren't able to go forward on that pathway anymore, but you can exit and go around and get to where you need to go.
In therapy, phrases are combined with music.
I am fine.
And gradually, the music fades away, and the words can stand on their own.
So what are you going to tell me? Yes. Give me a kiss right now.
And the last topic that the movie brought up was positive effects on social bonding, or that music has positive effects on social bonding. As the movie said, singing together doubles oxytocin levels. So oftentimes I tell caregivers or patients or the whole family that participating in a music therapy session or singing with a loved one can greatly reduce stress and help bond on a different level. So I have another song that we're all going to sing together so you can feel that oxytocin.
You need me to come up with the mic?
Building up. I guarantee you'll know this one. You are my sun. therapy is an evidence-based practice using music applications to achieve clinical goals through a therapeutic relationship. And with older adults with dementia, music therapy can be used as reality orientation to reduce agitation, for entrainment, and to increase positive social bonding. Thank you very much.